There are calls for greater funding for rural mental health services as a new study shows patients face increasing disadvantages the further out of town they live. James Cook University research has found Australians outside metropolitan cities face higher rates of attempted and completed suicide, worse mental health and greater barriers to accessing mental health care. Joining me now live is RACGP President Dr Nicole Higgins. Doctor, thank you so much for your time this afternoon. How dire is the situation in regional areas?
For regional, remote and rural areas, it is significant, and we know that most people have their family doctor and their GP is often the first port of call.
And so what sort of pressure are GPs
So what we're actually
under? Sorry, in the regions, what sort of pressure are they under?
We're facing workforce shortages in rural and regional Australia, and we're also facing shortages of mental health professionals such as psychiatrists and psychologists. So GPs are really shouldering a lot of that work, and we know the Health of the Nation report showed that about between 75% of our consultations actually were about psychological issues and their impact on the healthcare.
I guess this has been an ongoing issue, that there's been very difficult to be able to access mental health care in regional Australia. So what more can be done, in your view, to help improve mental health outcomes?
So we're calling for an urgent injection of funding, particularly targeting areas of need such as mental health. And the investment in rural mental health has been welcome, but we really need more. And we would really like to increase rebates for patients for those longer consultations, and also fund those longer telehealth consultations for those people who really struggle to get into town or have trouble with access.
You also mentioned staff shortages in the regions. How can Australia attract more health professionals to the bush?
Look, it's a complex problem. We've relied heavily on overseas trained doctors in rural Australia, where what we're looking at is exposing medical students and younger doctors to rural practice earlier, and also making it easier for those doctors who are wishing to come to Australia to be able to access their visas, etc. Because at the moment we're competing with other countries that are quite easy to get into, but it's really growing our own workforce.
Yeah, absolutely. I just want to ask you on another matter now. Obviously, with the Christmas festive period coming up, there's COVID cases that are still in the community. How can people best protect themselves?
Look, COVID,
Okay, I think we may have lost Dr Higgins, unfortunately. That line, a little bit scratchy there. We do appreciate Dr Nicole Higgins, though, joining us this afternoon. And just a reminder, though, if you or anyone you know is feeling distressed, you can call Lifeline on 13 11 14.